Hi, I'm Dennis Lenselink, Care Coordinator at AdvaCare Clinics in Bloomington, Minnesota. Today I'd like to talk to you about hemorrhoids. Not a subject that most people care to talk about, but it's a silent pain producer that many people live with. And if you're having problems with hemorrhoids, I'd like to give you a few quick and easy solutions that we have to help you eliminate them and deal with the pain issues that you may be having from day to day. Usually when you deal with hemorrhoids, you've tried creams and ointments to try and shrink it. Most of them don't work too good. When you go to the medical doctor, what you're looking for is a solution to get rid of them. One of the oldest techniques they'll employ for you is surgery, something that most people are a little skittish on having done. No one wants to have anybody cutting in and around the rectal area. Let's face it, it's not comfortable, and it can be pain-producing for several days or weeks afterwards. Another process that they came up with years ago is banding. Quite simply, it's a castration process where they use a rubber band. They'll use an instrument like this, where the rubber band fits around the tip here. They'll find the hemorrhoid, bring it up to it, and basically drop the rubber band off, and it rolls up over the hemorrhoid. If you look at the photo we have of this, it has a very good demonstration of what the process is like. Basically, it cuts off the blood supply to the hemorrhoid, and the hemorrhoid dies and dries up. You still can get the hemorrhoid back, though, if you have a weakness in the wall of the muscle or a vascular problem. The average person has 4.5 hemorrhoids. People can come in with more or less, depends on if you have fissures, which are cracks, that can also cause pain, itching, swelling, bleeding. These all have to be looked at to see what your problem is and what the best treatment approaches can be for you. Another procedure that we use in our clinic besides the banding process is a procedure called the Ultroid. The Ultroid process uses an electrical current. This therapy has been around since the 1950s. It's very well proven, has a long track record, and very safe and good results. What the doctor can do is run an electrical current that he can monitor through this device here, through a probe that fits into the rectum instead of the bander, and the current, a DC current, goes through there. It's painless, there's very little itching or bleeding. There's much higher patient compliance when they did a head-to-head double-blind test between banding, surgery, and the Ultroid. The Ultroid process won hands down. What it does is the current goes through the probe and it coagulates and shrinks the hemorrhoid. It basically dries up the blood supply, and it dries up and falls off, and shrinks it right down. So cooks it, for lack of a better term, and has a much better long-term outcome than the banding process too. Sometimes after banding, you're left with some residual tissue and there's bleeding and itching in there. Much less with this process. These are the two most proven and effective ways to try and deal in a conservative fashion before you talk about going in and cutting for hemorrhoids. If you have any questions, like a consultation to see if the Ultroid process would work for you, please feel free to give AdvaCare a call. Please see the number at the end of this video. Thank you.